In medicine, we learn that the body has a language. It communicates through signs and symptoms, and sometimes it even speaks through scent. This is the story of a patient whose life was saved because a sharp-nosed nurse recognized a smell that, to the untrained, might seem harmlessly sweet. Her name was Maya, a 20-year-old college student brought to the emergency department by her roommate. For a week, she'd been overwhelmingly thirsty and exhausted. But that afternoon, she became nauseous and started breathing in a strange, rapid, deep pattern. The most striking clue was in the air around her: faint, sweet, fruity odor. This wasn't exhaustion, this was a metabolic crisis. Maya's body was silently waging a war against itself. She had undiagnosed type 1 diabetes. Without the hormone insulin to act as a key, sugar was trapped in her bloodstream, leaving her cells starving. In desperation, her body began burning fat for fuel, producing acidic byproducts called ketones. Her blood was turning dangerously acidic, a state we call diabetic ketoacidosis, or DK. Her body's attempts to compensate caused the extreme thirst, and the deep, rapid breathing was a frantic attempt to expel the acid. That fruity smell, that was the scent of ketones on her breath. The diagnosis was confirmed within minutes. A finger-stick blood sugar test read HIGH, and a blood gas analysis confirmed severe acidosis. The treatment was a delicate, 3-part rescue mission, and for drip of insulin to act as the missing key, a flood of intravenous fluids to combat dehydration, and careful replacement of electrolytes. Slowly, the metabolic storm subsided, Maya's breathing returned to normal, and the fruity odor vanished. Her story is a critical lesson. A cascade of seemingly unrelated symptoms can signal a profound underlying disease. Now, for your NCLEX-style question, a 20-year-old patient presents with rapid, deep breathing, a fruity breath odor, and a blood glucose of 550 milligrams (dl). What is the nurse's priority intervention? Administer a bolus of 0.9% normal saline. B. Provide the patient with a snack. C. Administer subcutaneous long-acting insulin. D. Encourage slow, shallow breaths. The correct answer is A. The immediate priority in DKA is to correct profound dehydration and restore circulatory volume with fluids. Thank you for watching. Hope you learned something.